Let us discuss about anatomy of endocrine glands, part 5. In the current session, we will be discussing about adrenal glands. The paired adrenal glands or suprarenal glands, one of which lies superior to each kidney in the retroperitoneal space, have a flattened pyramidal shape. And in an adult, each adrenal gland is 3 to 5 centimeters in height, 2 to 3 centimeters in width, and a little less than 1 centimeter thick, with a mass of 3.5 to 5 grams, only half its size at birth. And during embryonic development, the adrenal glands differentiate into two structurally and functionally distinct regions called as adrenal cortex and adrenal medulla. A large peripherally located adrenal cortex comprises of 80 to 90% of the gland, and a small centrally located is the adrenal medulla. Cortex is the peripheral part and medulla is the central part. A connective tissue capsule covers the gland. The adrenal glands, like the thyroid glands, are highly vascularized. Adrenal cortex produces steroid hormones that are essential for life, and complete loss of adrenocortisol hormones leads to death due to dehydration and electrolyte imbalance in few days to a week unless hormone replacement therapy begins promptly. And the adrenal medulla produces 3 catecholamine hormones. Adrenal medulla produces 3 catecholamine hormones: norepinephrine, epinephrine, and small amounts of dopamine. Here you can see adrenal cortex secretes steroid hormones that are essential for life, and adrenal medulla secretes norepinephrine and epinephrine. This is the kidney, and these are the suprarenal glands. That is, they are superior to kidney. These are the adrenal glands, the pink ones. This is the right adrenal gland and this is the left adrenal gland. And these two are the kidneys. Here you can see adrenal gland regions. The outer region is adrenal cortex and the inner region is adrenal medulla. And adrenal cortex is again divided into zones: zona reticularis, zona fasciculata, and zona glomerulosa. Here you can see this is the kidney and this is the adrenal gland. And inside the adrenal gland, this is the capsule, this is adrenal cortex, and the middle central portion is adrenal medulla. Adrenal cortex is divided into zona glomerulosa. It secretes mineralocorticoids, mainly aldosterone. The next region is zona fasciculata. This one, zona fasciculata, it secretes glucocorticoids, mainly cortisol. And finally, zona reticularis, it secretes androgens. And this is the adrenal medulla. It contains chromaffin cells that secretes epinephrine and norepinephrine. Now coming to adrenal cortex. The adrenal cortex is subdivided into 3 zones, each of which secretes different hormones, as we have discussed earlier. The outer zone, just deep to connective tissue or connective tissue capsule, is the zona glomerulosa. It is the outer zone. And its cells, which are closely packed and arranged in spherical clusters, are arched columns. Spherical clusters and arched columns secrete hormones called as mineralocorticoids. Zona glomerulosa secretes mineralocorticoids because they affect the mineral homeostasis. And the middle zone is the zona fasciculata. It is the widest of the 3 zones and consists of cells arranged in long straight columns. And the cells of zona fasciculata secrete mainly glucocorticoids, primarily cortisol. So named because they affect the glucose homeostasis. They are called as glucocorticoids because they affect the glucose homeostasis. And the cells of the inner zone, zona reticularis, are arranged in branching cords. They synthesize small amounts of weak androgens, steroid hormones that have masculizing effect. Now coming to mineralocorticoids, aldosterone is the major mineralocorticoid. It regulates the homeostasis of 2 mineral ions, namely sodium ions and the potassium ions, and help regulate adjust blood pressure and blood volume. Aldosterone also promotes excretion of hydrogen ions in the urine, and this removal of acids from the body can help regulate the acidosis, that is blood pH. If it is below 7.35, aldosterone helps regulate the acidosis. Now coming to the regulation of aldosterone synthesis. The renin-angiotensin-aldosterone RAA, renin-angiotensin-aldosterone pathway controls the secretion of aldosterone. The stimuli that initiate the renin-angiotensin-aldosterone pathway include dehydration, sodium deficiency, and hemorrhage. These conditions cause a decrease in the blood volume, and decreased blood volume leads to decreased blood pressure. Lowered blood pressure stimulates certain cells of kidney called as juxtaglomerular cells to secrete the enzyme renin, and the levels of renin in the blood increase. And this renin converts angiotensinogen, a plasma protein produced by liver, into angiotensin 1. Renin converts angiotensinogen, a plasma protein that is produced by liver, into angiotensin 1. The blood containing increased levels of angiotensin 1 circulates in the body. As the blood flows through capillaries, particularly those of the lungs, the enzyme angiotensin converting enzyme ACE, it converts the angiotensin 1 into hormone angiotensin 2. Angiotensin converting enzyme converts angiotensin 1 into angiotensin 2, and this results in the increased blood levels of angiotensin 2. And this angiotensin 2, it stimulates the adrenal cortex to secrete aldosterone. And blood containing increased levels of aldosterone circulates to kidneys. And in the kidneys, the aldosterone increases the reabsorption of sodium, which in turn causes reabsorption of water by osmosis. As a result, less water is lost in the urine. Aldosterone also stimulates the kidneys to increase the secretion of potassium and hydrogen into the urine. With increased water reabsorption by the kidneys, blood volume increases. And as the blood volume increases, the blood pressure increases to normal. Now, other actions of angiotensin 2 are, this angiotensin 2 also stimulates contraction of smooth muscle in the walls of arterioles, resulting in the vasoconstriction of the arterioles. It increases the blood pressure and help regulate the blood pressure to normal. Besides angiotensin 2, a second stimulator of aldosterone synthesis is an increase in the potassium concentration of blood. A decrease in the blood potassium levels has an opposite effect. Increased blood potassium levels leads to angiotensin secretion, whereas decreased potassium levels will inhibit the secretion of aldosterone. So aldosterone helps regulate the blood volume, blood pressure, and the levels of sodium, potassium, and hydrogen in the blood. So what is a triggering point for aldosterone synthesis? The first point is either dehydration, sodium deficiency, or hemorrhage. This triggers the renin, angiotensin, and aldosterone pathway. Either dehydration, sodium deficiency, or hemorrhage leads to decreased blood volume. Decreased blood volume decreases the blood pressure. And decreased blood pressure, it stimulates the juxtaglomerular cells of the kidney to release renin. This renin, it converts angiotensinogen, which is released from the liver, into angiotensin 1. This angiotensin, when it enters the lungs, here it is converted to angiotensin 2 by the action of angiotensin converting enzyme. This angiotensin 2, it acts on the adrenal cortex, and this leads to synthesis or increased levels of aldosterone. Increased levels of aldosterone, they act on the kidney, where increased sodium and water reabsorption takes place and increased secretion of potassium and hydrogen into urine occurs. This is the major action. By this, it increases the blood volume. Increased blood volume increases the blood pressure until it returns to normal. One more action of this angiotensin 2 is it leads to vasoconstriction of arterioles. This in turn also leads to or contributes to increase the blood pressure to normal. Now coming to glucocorticoids. The glucocorticoids which regulate metabolism and resistance to stress include cortisol, also known as hydrocortisone, corticosterone and cortisone. Of these three hormones secreted by zona fasciculata, cortisol is most abundant and accounts for about 95% of glucocorticoid activity. The glucocorticoids have the following effect. The first is protein breakdown. Glucocorticoids increase the rate of protein breakdown mainly in the muscle fibers and thus increases the liberation of amino acids into the bloodstream. These amino acids may be used by body cells for synthesis of new proteins or for ATP production. The next is glucose formation. Hence the name glucocorticoids. On stimulation of glucocorticoids, liver cells may convert certain amino acids or lactic acid to glucose, which neurons and other cells can use for ATP production. Upon the stimulation of glucocorticoids, liver cells may convert certain amino acids or lactic acid to glucose, and this glucose is used by neurons and other cells for ATP production. Such conversion of a substance other than glycogen or another monosaccharide into glucose is called as gluconeogenesis. The next is lipolysis. Glucocorticoids stimulate lipolysis, the breakdown of triglycerides and release of fatty acids from adipose tissue into the blood. The next is resistance to stress. Glucocorticoids work in many ways to provide resistance to stress. The additional glucose supplied by the liver cells provide tissues with a ready source of ATP to combat a range of stresses including exercise, fasting, fright, temperature extremities, high altitude, bleeding, infection, surgery, trauma and disease. Because glucocorticoids make blood vessels more sensitive to other hormones, they cause vasoconstriction that raise the blood pressure. This effect would be an advantage in severe blood loss, which causes blood pressure to drop. The next is anti-inflammatory effect. Glucocorticoids inhibit white blood cells that participate in inflammatory responses. Unfortunately, glucocorticoids also retard the tissue repair. As a result, they slow wound healing. Although high doses can cause severe mental disturbance, glucocorticoids are very useful in the treatment of chronic inflammatory disorders such as rheumatoid arthritis. The next action is depression of immune responses. High doses of glucocorticoids, they depress the immune response. For this reason, the glucocorticoids are prescribed for organ transplant recipients to retard the tissue rejection by the immune system. As they depress the immune responses, it is prescribed for organ transplant recipients to retard the tissue rejection by the immune system. Coming to control of glucocorticoid secretion. The control of glucocorticoid secretion occurs via a typical negative feedback system. Low blood levels of glucocorticoids, mainly cortisol, stimulate neurosecretory cells in the hypothalamus to secrete corticotropin releasing hormone CRH. This corticotropin releasing hormone along with low level of cortisol promotes the release of ACTH from the anterior pituitary. This ACTH flows in the blood to adrenal cortex where it stimulates the glucocorticoid secretion. And to much lesser extent, or smaller extent, ACTH also stimulates the secretion of aldosterone. Coming to androgens, in both males and females, the adrenal cortex secretes small amounts of weak androgens. The major androgen secreted by adrenal gland is dehydroepiandrosterone, DHEA. After puberty in males, the androgen testosterone is also released in much greater quantity by the testes. Thus, the amount of androgen secreted by adrenal gland in the males is usually so low that their effects are insignificant. Whereas in females, adrenal androgens play important roles. They promote the libido and are converted into estrogens by other body tissues. After the menopause, when ovarian secretions of estrogen ceases, all female estrogens come from the conversion of adrenal androgens. And the main hormone that stimulates its secretion is ACTH. Next, coming to adrenal medulla. The inner region of adrenal gland is the adrenal medulla, is a modified sympathetic ganglion of autonomic nervous system. It develops from the same embryonic tissue as all other sympathetic ganglion, but its cells which lack axons form the clusters around large blood vessels. Rather than releasing a neurotransmitter, the cells of the adrenal medulla secrete hormones. The hormone producing cells called as chromaffin cells are innervated by sympathetic preganglionic neurons of the ANS. Because the ANS exerts direct control over the chromaffin cells, hormone release can occur very quickly. The two major hormones synthesized by the adrenal medulla are epinephrine and norepinephrine, also called as adrenaline and noradrenaline respectively. The chromaffin cells of adrenal medulla secrete an unequal amount of these hormones, about 80% of epinephrine and 20% of norepinephrine. And the hormones of the adrenal medulla intensify sympathetic responses that occur in other parts of the body. The hormones of the adrenal medulla intensify the sympathetic response that occurs in the other part of the body. Coming to the control of secretion of epinephrine and norepinephrine. In stressful situations and during exercise, the impulses from the hypothalamus stimulate the sympathetic preganglionic neurons, which in turn stimulate the chromaffin cells to secrete epinephrine and norepinephrine. These two hormones greatly augment the fight or flight response. By increasing the heart rate, force of contraction, epinephrine and norepinephrine increase the output of heart or cardiac output of heart, which increases the blood pressure. They also increase the blood flow to heart, liver, skeletal muscles and adipose tissue, dilate the airways of the lungs, and increase blood levels of glucose and fatty acids. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.